Removing previous crowns is a delicate and stressful situation. It's like a box of chocolates. You never know what's in the middle until you take a bite. Christensen Crown Removers are used to lightly disengage the previous cement seal. Be sure to tell the patient they might hear a little small click so they don't get surprised. In this case, Zirconia BruxZir Aesthetic NOW requires a minimum of millimeters, so I typically reduce 1.5 to 2 millimeters to ensure there's space to fabricate beautiful anatomical crowns. Hello, I'm Dr. Ginny Bender. I'm an in-house clinician at Glidewell. This patient presents with extreme dissatisfaction of his crowns number 8 and 9. Although he likes the shape of them, minus the porcelain chip on number 9, he doesn't like the color or the fit of these zirconia layered crowns with open margins. First, I get a digital pre-treatment scan using Medit i700. The upper, lower, and bite dentition and soft tissue are quickly captured comfortably for the patient. Our lab finds digital impressions to be extremely accurate. It also helps me visualize the condition on a big screen. It's much easier to communicate to the patient and the lab the treatment plan and goals. This digital acquisition captures the original shape of 8 and 9 so I can copy and paste when I design the new crowns using a modern-day CAD/CAM system called Glidewell's in-office solution. Second, the treatment plan is to restore 8 and 9 with Glidewell's BruxZir Aesthetic NOW same-day zirconia crowns. Removing previous crowns is a delicate and stressful situation. It's like a box of chocolates. You never know what's in the middle until you take a bite. The worst-case scenario is there might be a large, non-restorable carious lesion with very little tooth structure left. Thirdly, I use ISO-dry system for isolation. Careful removal of zirconia crowns is done by using brand new red-striped fine grit, long tapered diamond burs with copious water at 20,000 RPM with a light touch. Buccal incisal and lingual cuts is my approach. You know what gets us dentists excited? When we start seeing show-through of tooth and cement. Christensen Crown Removers are used to lightly disengage the previous cement seal. Be sure to tell the patient they might hear a little small click so they don't get surprised. If necessary, I place another cross-cut using a fine grit, small diameter flame-ended diamond burr on the buccal to release the distal pieces gently. Continue crosscuts until all restorative material has been released. Caries on adjacent teeth is best restored when access is easy and optimal as shown here. A core structure provides better retention for future crowns. Using a fine diamond round-ended tapered burr, residual cement is removed. Composite restorations are placed on 7 and 10 and buildups on 8 and 9 using 35 to 37% phosphoric acid etch for 15 seconds. Copious water rinse is done without desiccating the dentin. Gluma is applied as a desensitizer to seal in the dentinal tubules and disinfect the teeth. Suction the excess and wait for the glossy appearance to disappear, which takes about 60 seconds. Be careful not to get any on the soft tissue as it can be an irritant and create bleeding. Next, I scrub in for 20 seconds ScotchBond Universal by 3M to create adhesion of the tooth to the restorative material. Air dry to thin layer for 5 seconds and light cure for 10 seconds. Omnichroma bulk and flowable are used as composite restorative materials. Finishing and polishing is quickly done using Solflex finishing discs. Refined preparation of 8 and 9 is done using a long tapered fine diamond burr to create 2 plane reduction, 360-degree chamfer margin, and adequate lingual preparation to prevent under-reduction problems that may violate minimal thickness issues based on the final crown material. In this case, Zirconia BruxZir Aesthetic NOW requires a minimum of 0.7 millimeters, so I typically reduce 1.5 to 2 millimeters to ensure there's space to fabricate beautiful anatomical crowns. Kerr makes a bite tab that helps check that I have sufficient reduction. Keep in mind to remove any sharp edges from the preparation that may inhibit proper milling and create over-contoured bulky crowns. I again use Solflex discs to even out my preps, polish the adjacent restorations, and provide guide planes for better path of insertions, and adjust opposing unsupported enamel chips. For tissue control, I use the 2-chord technique. The first chord, size 000, is placed gently into the sulcus for apical compression. Make sure to angle the cord packing instrument towards the root of the tooth to avoid damaging PDL fibers. The second chord, size number 1, previously soaked in Hemodent, is placed over the first chord for lateral deflection. I like to leave a little tail on the buccal for easy identification and removal later. 5 minutes of compression is needed prior to cord removal. For the anterior, 2x2 gauze or copper cap can be placed over the preparations for that compression. Final digital impression is next. Make sure to isolate the area, rinse and dry, and make sure it's free of debris and turn off the overhead and loop lights. Scan the preps first before the tissue slumps into the sulcus. Then scan the rest of the quadrant or full arch. Scan the opposing and get the bite registration. Make sure they're biting all the way down. Not only do I save money on impression material, going digital opens up the gate to milling out same-day crowns, giving us full control of the design, margins, and contacts. Scan seamlessly pair to work with Glidewell I/O system in-office solution. When your digital impression enters the software system, the CAD, also known as computer-aided design, will seamlessly identify your margin by utilizing artificial intelligence called AI. After I confirm my margin, I click for design. I'm given a computer-generated crown, also given by AI. In this case, I copy and paste the pre-treatment scan. This design option is so handy to replicate most or all the original tooth shape and anatomy. It's great for patients who use removable aligners, or sleep, or snore appliances. I have the power to add material digitally to reshape that chipped area very easily. Then I check my milling and insertion to ensure the path of insertion is green. That makes the crown delivery much easier for me later. Then I check where the sprues are located to visualize those blue circles and know where the sprues are going to be. These crown designs took about 5 minutes. The CAM, or computer-aided manufacturing portion, is with the fast mill. A fully sintered BruxZir Aesthetic NOW crown can be made in about 35 minutes. NOW stands for no oven wait, which means we don't have to spend more chair time using an oven to post-process zirconia after milling. Same day is within our fingertips with a streamlined workflow. Prep, scan, design, and mill. We can see the sprues snap off easily and polish quickly. Air abrasion is done to the inside intaglio to enhance micromechanical retention of surface area with the cement. Glidewell Laboratory always air abrades or sandblasts. Glidewell Laboratories always does it, but for in-office BruxZir Aesthetic Zirconia crowns, it's done chairside. BruxZir Full Strength is roughened by blasting 50 microns of aluminum oxide for 15 seconds. For BruxZir Aesthetic, 30 microns of 3M Cojet at 30 psi is done for 15 seconds. Crowns are tried in to check for the fit to the margin and adjust those contacts. Ivoclean is used to clean the inside of the restoration, to decontaminate. I use a clean microbrush and scrub the intaglio for about 20 seconds and then rinse and dry. You can even use 1 to 5% sodium hypochlorite as a cleaning agent. Make sure not to use phosphoric acid, which will interfere with proper cementation. Cementing zirconia can be simplified using BruxZir Dual Cure Resin Cement. It's a self-adhesive resin cement that is versatile, color stable, and efficient. It eliminates several steps in the bonding protocol, and that saves money and excessive chair time. Tack cure for 1 to 2 seconds to initiate the gel-like state for easy, gross cement removal. As the cement continues to set on its own, fine cement is carefully removed while still providing incisal or occlusal pressure. Without light curing, it sets within 90 seconds. I do recommend doing a final light cure for 20 seconds on each surface at the end. After rechecking the occlusal contacts, any further adjustments are made using BruxZir Finishing and Polishing Kit. It has everything I need to regain a smooth, shiny surface that's going to be kind to the opposing dentition. The red striped diamond burrs help with the gross adjustments. Then, the finishing cups, using green, brown to white, are used to create smoother quality and ends with the wheels to create that ultimate polish. Use light touch with water if possible at a maximum of 20,000 RPM. With a simplified protocol and a more universal cement like BruxZir Dual Cure Resin Cement, Zirconia cementation has never been easier. At the end of the day, it's not only about making it easier on us, it's also about making it easier on our patients and giving them a same-day, beautiful zirconia restoration that makes them smile with confidence. Same-day crowns with Glidewell's in-office solution. You too can provide high-quality, strong, and beautiful BruxZir Aesthetic NOW crowns that are easy to cement using BruxZir cement. This is tooth number 14 with a large silver filling, or what we call in dentistry an amalgam restoration. It's an amalgamation or mixture of powdered and liquid metals such as silver, copper, and tin with mercury.